Ever wondered what a job full of animals would look like? Well, I'm glad you joined us today. Welcome to MedUnite's very own podcast, where we encourage and guide youth into the fascinating universe of medicine. My name is Kasturi, and I'll be your host for this episode. Our guest speaker today is Dr. Grant Dunbar. He is a 2013 graduate of Western University of Health Sciences. After graduating, he completed a rotating internship at Animal Emergency Medical Center in emergency medicine, internal medicine, and surgery. He currently owns a practice called Chino Hills Animal Hospital in California and employs over 85 staff members and around 10 doctors. He was featured on a TV show for Discovery Plus called Pop My Pet, where he performed a severe inguinal hernia repair with a surprise organ that had been stuck inside. You can find him and follow his surgeries on a day-to-day basis on Instagram at Dr. Grant Dunbar.
All right. So my name is Grant Dunbar, So a little bit about me. I was born and raised in Orange County, California. I then went and graduated from Western University of Health Sciences for my doctorate in veterinary medicine. And then I own my own clinic, Chino Hills Animal Hospital. The areas of medicine I currently focus in are predominantly surgery, special procedures, and then emergency medicine and critical care, on top of just being a general practitioner. And then recently I've been doing a little bit more with Discovery, and we did a TV show called Pop My Pet. So that's kind of everything in a quick summary, but I'll go into detail here. So I always think it's important to have hobbies and things that you do outside of school or your career. I think it keeps you mentally healthy and physically healthy. And I just feel that if you have some sort of outlet when you're putting in that hard work for school or your job, it gives you kind of a reset button. And for me, that's always been very critical in my own mental health, because I work very long days. I have a family, I have a business I run, and I need me time. And fishing, free diving, cooking, and just being outdoors is my reset. I don't have a phone usually when I'm out there doing it. And it really helps me to just reset myself. So throughout your lives, find those things that make you happy. Find those things that are typically, set aside from your career path that you can get away, you can do, you can reset your mind. And then when you go back to school or work, you're going to be that much more focused and that more driven, because you've had a break and you've been able to reset and now stay focused again. So my journey started, my dad was a veterinarian, and as early as I can remember, I would go into his hospital practice, and I used to go in there and just spend time. I loved animals. I loved all different types of animals. I loved learning about them, what their needs were, how to care for them. I had all sorts of pets growing up. I used to walk around the hospital and just ask, does this one have a home? Does this one have a home? Does this one have a home? And then try and take home whatever didn't have, a family or a parent, and then, try and take care of them and have those pets. So I had everything. And that really helped me to learn husbandry, learn, what these animals need, how long they live, their personalities, behavior. So that really set my foundation of my love for animals. My dad used to have me just come in when he would do surgeries. He worked a lot when I was growing up. He was definitely dedicated to his job, and he worked. All I remember was him working. And then, like myself, we would go fishing, we'd go camping, and those were kind of his reset. And I enjoyed doing that as well as a kid. But I used to go and go at night. My mom would send me over to the hospital, and I'd sit there and watch him do surgeries when I was 5, 6, 7, 8, 9, 10. Just so there was somebody else there in case something happened. But those were my earliest memories. As soon as I could really work, I would go to his hospital after school and spend time and help, learn how to hold animals, restrain them, learn which dogs looked aggressive, which ones you could go up and pet, get exposed to blood and picking up poop and the kind of the dirty side of jobs. And my dad was always, I'd say, probably tougher on me than the average person. And I think it's because he never wanted to feel like he gave me anything, in the sense that I walked in there and I was a doctor's son. So I had to work for everything I got, working for him. So I started off as kennel, cleaning cages, picking up after dogs. And I did that for years. And then I worked up and I started doing, cleaning packs and doing surgical equipment. And then kind of worked into being a tech assistant, where I had more training and worked a lot more with clients and loading rooms and taking temperatures on dogs and cats, learning how to read the microscope and do fecals, run blood work. And I just kind of worked myself up the ranks throughout the years. So that was just my life. I loved being around hospitals, and it was really all I knew. Moving forward, I was never what you would consider a good student. I just feel like I never really liked school all that much. I would study and I'd get decent grades, but I didn't love homework. I didn't love the long hours. I wanted to go outside and play with my friends and be a boy, and I had teachers when I was a kid who used to tell my mom, Grant's not going to make it to college. He's not going to, he's not going to do much. You really need to stay on him. And I think it was just because I enjoyed being outside. I enjoyed doing other things. And I think the reason I bring that up is, if you feel like you're not the smartest person in your class, you feel like you're defeated because, a teacher or professor doesn't believe in you, don't let that prohibit you. I mean, if you're driven, if you're a hard worker, I truly believe anything's possible. So, just because you're not the top in the class, don't let it discourage you at all, because other factors come into play. And one of those factors is being a hard worker. And if you can, work when you need to and learn how to play and have fun, and be just a well-rounded person, you're going to get places in life. Because a lot of the people that went through school, that either burn out early or just didn't continue that drive they had, they fell short. So staying balanced, staying focused, but also having fun is a big part of getting to your end goal. Like I said, in high school, I wasn't the best student. I got through school and I learned, but I wasn't the best student. But I did try and get good enough grades because I knew I wanted to do something with my life. I didn't know I wanted to be a vet at that time, but I knew I wanted to do something. And my dad enforced in me that I needed to get good grades if I wanted to be a vet or if I wanted to do something in a medical career. So moving on, I got into a few different universities, but I chose to go to Cal Poly Pomona, which for me is just about 30 to 45 minutes away from where I grew up. And that gave me the opportunity to go home on the weekends, but also I was able to live at school, which I really wanted. I wanted to be able to feel like I was independent on my own. And to me, that was important. So I started off as a pre-vet major, which Cal Poly has. But our first week of school, they pulled all of us into a big room at all the pre-vet majors. And they told us 1 out of every 100 of you will graduate as a pre-vet major, and 1 out of every 100 will make it into vet school. Unless you have a plan B, unless you're going to be the top of your class, you better have a plan B, which was very discouraging for me because I thought in my head, why am I going to work so hard to not make it? And I kind of reevaluated what I wanted to do in life, and I knew I wasn't the top of my class. So I kind of took a step back and then started taking some business classes and some other classes. And I did that for about 1.5 years, but I just didn't feel like it was necessarily 100% for me. I still had that end goal of potentially wanting to be a veterinarian. And to me, it was just all I knew. It was what I loved. So I had an eye-opening moment. I think it was about the end of third year, when I was talking with one of my advisors, and she basically had told me, we don't have to be pre-vet to get into vet school. You just have to have the requirements. So I figured out that I could basically have a major that wasn't pre-vet, but I could also take other courses. And for me, that was a life-changing moment because I had this business major that I could fall back on if I didn't get into vet school, but I could also strive for my goal. So I buckled down, I studied, I worked really hard to boost my GPA so that I could apply to vet school. And if you look at these different universities that you want to go to, you can see on their websites what the requirements are. So I kind of did a summary of what most vet schools wanted or needed me to take, and then I went and took all those courses. And it took me 5 years to get through, but I kind of had this business major with almost like a minor in what would be pre-vet if they would have offered that, or biology. Because I knew a lot of people at the time that were going through school, they graduated as pre-vet, and then they applied to vet school, and then they didn't get in. And then it was kind of one of those things at the time where, well, what do you do with a pre-vet major if you don't get into vet school? Besides reapply and try and kind of boost up your GPA or do different opportunities. And kind of going to that is by working in and around hospitals and getting experience, and also even doing things like getting a master's degree. Those are other things that can help kind of boost your resume and help you get into school if you're looking for other things to make you look more desirable to these universities. And then I applied to some schools out of the country. Down in the Caribbean, they have one vet school. And then I applied to a private university that was local in Pomona, which is actually kind of right where I went to my undergrad at. I had the opportunity that I knew somebody who was applying at the same time. He had about the same GPA I had. So I was able to kind of utilize what schools he got into to mimic where I applied, because I figured there's a lot of work to apply to 10 different veterinary schools. And if they weren't going to accept him, they probably weren't going to accept me. So I applied to those two. I actually got into both of them. One of my advantages was I had about 10,000 hours in a vet hospital. So I think that kind of helped boost me up among the ranks. And then I ended up choosing to go to Western University, which is right there next to Cal Poly Pomona. It's a private university, so tuition is a little bit more expensive than if I went to Davis, which is also in California. But for me, it was nice and close to home. I was familiar with the area, and that's where I chose to go. Western is a little bit different than the traditional schools in the sense that they have what's called problem-based learning. So we don't have your typical classes. You don't go sit in a class and somebody lectures to you for an hour about physiology, and then you go to anatomy and they lecture you about anatomy for an hour. It's very different. It's very minimal class time, if any class time. It's more kind of a, I guess I'll give you an example. So 3 days a week, we would meet and we would spend a few hours in a small group, and then we would go through cases. And then you learn about those cases. So they would have a presentation, and they would go through the clinical presentation of the case. They would talk about it, and then we would go home and then we would learn about that type of case, the clinical presentation, the anatomy revolving that case, pharmacology, the pathophysiology of what diseases may be going on. And we would learn about it at home. It's very self-directed. And then we had an anatomy lab, and we had a pathology lab, and then we would go into those labs and we would learn about the anatomy through cadavers. We would basically look at cadavers, look at our textbooks, and then you basically kind of self-teach yourself those different areas of medicine until, as you go through the first year into the second year, you basically covered most of the anatomy for everything from dogs and cats to cows, horses. We even learned about reptiles, avian species, all sorts of different stuff. Llamas. I mean, we really had some out there cases, but it helped make us very diverse. And their ideology is that when they teach, the schools that have more of a professor-based classroom learning style, once you get out, a lot of that information has become outdated already with how fast technology is going. So you have to continue to learn on your own and find resources of how to learn this information. So they felt that they were giving us the tools to do that by having us, more or less kind of teach ourselves these different areas. And then we would be tested every 8 weeks. And the tests were very in-depth and very difficult. So you spend a lot of time studying. I mean, it was a lot of time studying. But at the end of it, you definitely feel very self-sufficient. Third and fourth year, we did rotations. So we would rotate through different vet hospitals, a lot of different scenarios. We'd go work at ranches and dairy farms and go to different equine facilities and really learn about all the different animals. Even if you knew what you wanted to do, if you were going to be a small animal vet, you still went and learned about everything. We went and spent times at labs. So you spend a lot of time away from the university third and fourth year. And then our fourth year particularly, you get to choose your rotations in your specific area of interest. So I did a lot of rotations in internal medicine and surgery and dermatology and ophthalmology, and that helps you to further understand those more specialty type areas of practice that you can do aside from just general medicine. For you guys, if you're looking into going into veterinary medicine, it is something to look at, whether you go in your own state or out of state or even out of the country. I mean, nowadays, they have these universities that are all over the world, really. Some are accredited in the US and they have kind of a smoother path into getting back into practicing in the United States. Some of them are a little bit more challenging. But I know the one Ross, they did get accredited, I think after I finished school, and they have a 3-year program, but their 3-year program down at Ross in the Caribbean is year round, whereas we had summer, kind of a short summer off. And then they go and they spend 2 years in the US before they graduate. So it's a little bit different, but you're in a beautiful area. And I think their schools are just as good as ours, at least this one is. I have a doctor I hired from there, and he does a great job. And it's really about how hard you work while you're down there, not necessarily always the education that the professors are providing. I think they all do a very good job. I think it's really, how much you're able to soak in and how hard you're willing to work, and what you're going to get out of it. And even though I was telling you before, I wasn't a very good student, when I got into vet school, I mean, I lived and breathed veterinary medicine. My biggest problem was getting enough sleep because I would stay up so late, just studying. And part of that was because I didn't have some of the undergraduate experience academically as some of my the other students did. So I really felt like I needed to catch up in that sense. And since then, they've changed a lot of the prerequisites so that I think more of the incoming students are getting a better, well-rounded foundation before they get to school. But for me, going as a ag business major and only taking a few biology and chemistry and physics classes, and then going into a self-taught program, there was a very big gap, which for me was overwhelming. So like I said, I think they've corrected some of that, but for me, that was challenging. Now, when I got out of veterinary school, I did an internship. And internship is optional. You can get out of school and you can go straight into practice. Some of these students are looking for a mentorship where they're working with or under a veterinarian who has experience to learn those lessons and skills and integrate that medicine as they get out. Other students or graduates can go out and do an internship, which is what I did. An internship is more or less kind of a formal job for a year. And you're really working at a specialty location, especially a hospital that offers different types of areas in veterinary medicine. And these can range from just a few different specialties to some of the larger practices that offer, 5 or 6 or 7 different specialists can get a much wider scope of medicine. So I kind of knew I didn't want to do a residency and specialize, so I did the internship. The internship was in emergency medicine and critical care. It was in surgery, and then it was in internal medicine, which is the 3 main areas I wanted to focus on once I got out. The other option for graduates is you can do what's called a residency. Now, residency is usually about 3 years. Some of them are 4 years, and residencies are indicated if you want to go and specialize. So if you want to be a board certified veterinary dermatologist or ophthalmologist or internist or surgeon, then most of those specialists are doing an internship, what we call rotating internship, where you rotate through multiple specialists, and then doing a residency on top of it. So it's another, let's say 3 to 5 years. You're out working, but you're working underneath somebody. You're getting paid a much less, anywhere from my internship. I think I got paid $30,000. Some of the residents are probably getting paid upwards of 50 to 60, but you're getting paid a lot less than if you just went out and practiced. And for a lot of these students, you have to take into consideration that you're going to have some pretty big student loans. If you go to a private university, it's definitely going to be more expensive than if you just go to a state university. And those loans are going to have a compounding interest rate, which is going to accelerate very fast. So for me, my focus getting out of school was paying those student loans down. And that's something to definitely consider. Think about how much loan, how many loans you're going to need to be taking out, what that's going to look like, what your end pay is going to look like, because it will affect your career and your lifestyle afterwards. So once I got out of school, my main goal was to gain experience. And I feel like this is very important for anybody who's going to be a medical professional. Is, when you get out, pay is important and you want to pay down those student loans, but you also want to gain experience when you first get out. The main focus for me was gaining experience. And I definitely recommend that to anybody who gets out of school, because you're able to build off that academic foundation you have, and you can go straight into your professional career and learning clinical experience off of that. So my dad was a veterinarian. I worked with him. I learned how to do surgeries, and I would spend many hours after work doing that, just learning surgeries, learning new procedures, just soaking up as much knowledge as I could after my internship. I then went and did emergency and relief shifts, and I enjoyed the side of emergency medicine, but for me, it was more of helping just make some extra money on the side and help pay down those student loans. And then for most veterinarians, we work 10-hour shifts. You can find a few places that may do 8s, but most veterinarians, I'd say, work 4 10-hour shifts. So I worked full-time on top of that. And then I learned how to do some specialty procedures, such as knee surgeries. I was just starting to learn to do some fracture repairs at that time, and some advanced soft tissue surgeries. So there's a lot of general practitioners out there that don't feel confident with surgery. They're not teaching it in school as much as they were. And a lot of general practitioners, most, if you guys have animals and you go to your kind of regular family vet, they'll spay neuter your dogs and they'll do some surgeries, but most of them don't do orthopedics. Most of them don't do advanced abdominal surgery or soft tissue surgery. So I learned how to do that, and then I would actually travel around and do advanced surgeries for a lot of the local hospitals to make some extra money on the side. And once again, this helped pay off those loans and get that loan amount down. And then I kind of hit a point I needed to come up with a long-term plan. And for me to make the money that I wanted to make, I knew I either needed to be an emergency vet or I needed to start my own practice. So emergency medicine requires a lot of odd hours, long hours. So I didn't really want to do graveyard shifts, and I ended up having the opportunity to buy a practice. So I ended up buying a practice with my brother, who's not a veterinarian, but he is more or less from the business side. So we bought a hospital called Chino Hills Animal Hospital in 2017. It's a 3 to 4 doctor small practice at the time. They had about 20 employees. They were open Monday through Friday and half day on Saturday. They also had an equine side. Half of it was equine, but at the time, the horses and a lot of the stables in the area had kind of moved out of town. and they were no longer even using that. So it was a 10,000 square foot building on 3 acres right off the freeway. So for us, it was a great location. So we bought that and then really focused on growing the practice. And for me, I'm definitely, a medical professional. We really enjoy that, but I also enjoy the business aspect. And for a lot of you, if you're going to go out and become doctors, there's going to be that aspect to owning your own practice, and whether you want it to be just you or you want it to be a multi-doctor practice. And there's a lot of opportunities for growth, and there's a lot of things that you can do within those fields. So I'm going to touch on that a little bit for those of you who are interested in that. So we immediately started making different improvements. We turned the large site into boarding and doggy daycare. I expanded the hours gradually. I started working full days on Saturdays, and that took off. And then once that took off, we started opening on Sundays. And most veterinary hospitals are not open on Sundays, so that became also a very busy day. It remains a very busy day for us. I started offering some of these unique procedures I do. So I do laparoscopic procedures. I do, like I said, a wide range of surgeries. I even started getting into more regenerative medicine, so like stem cells and PRP. And then we just had a philosophy of, we're going to practice good medicine, we're going to make it affordable, and we're going to meet our clients' needs, and just try and practice good medicine. And it's really taken off. We have, I don't know, probably 7 or 8 hospitals in the general vicinity, but we've grown to definitely be the largest, especially the largest privately owned practice. So now we've grown the practice. We have about 10 doctors and over 85 employees. We've had 50% growth year over year. And one of the things that I've wanted to do is always just kind of expand and do new things. So we started a charity. It's going to be annual, but with COVID, it's kind of had to be put on pause. But we did a big charity event in the back there on that extra land for veterans as well as rescued pets. Brought the whole community together, and that's something that I was really proud of. We were able to get statewide coverage on it, and have just a really great showing. So that was something that, like I said, I'm very happy to have offered our community, and we hope to continue to offer. And then recently, I was asked to do a show for Discovery Plus called Pop My Pet, and that's been definitely a unique experience, where we basically are doing advanced procedures on dogs and removing big masses. I did a hernia repair. The dog has its entire uterus herniated through its inguinal canal, which is down kind of by its leg. So it's definitely a unique case. And then recently, just yesterday, I did a interview for E-News. So, whatever profession you go into, there's going to be a lot of different opportunities, not just in that area of medicine, but also business or TV or charities. And I think diversifying your day-to-day helps to keep things interesting and fun and fresh, and keeps you excited about it, because doing some of these, or working for some of these practices where you're just doing the same mundane task day after day after day. I think there are some people who may enjoy that, but I think for a majority of us, it gets boring and it gets monotonous. And I think we all strive to feel like you're continually growing and learning. So my recommendation for anyone who's thinking about going into veterinary medicine, and I think probably just medicine in general, is gain a practical experience in the field that you're interested in. Go spend time, check them out, go work at different hospitals or volunteer at different hospitals. See what you like, what you don't like. We have a lot of students and kids that are even interested, and we let them come in and see what we do day in and day out. And sometimes a dog poops and they I can't deal with that. It's like, well, if you want to go into the field, animals are going to poop and pee, and you're going to have some gross things happen that you're going to have to be comfortable with. So you want to figure that out before you dedicate all this time in school towards one specific career path. Second would be research your schools. Look and see what schools what they offer. What their academic day-to-day is like. like mine was problem-based learning. That's much different than our traditional schools. And also see what their lifestyle's like. See, what kind of lifestyle you're going to want, and that's going to change over time as well. When you go to school, you may have the time to dedicate to working 60, 70, 80 hours a week. But if you end up, having kids and starting a family, you may not want to work that much, which is very understandable. Figure out, where you want to not only go to school, but also where you want to live. Once again, I said the hours, what kind of hours you're looking at working, and then what stress level you're able to handle. Different professions will carry a different level of stress. I've created a lot of stress for myself in the not only type of medicine I practice, but also, in owning my own practice. I have a very high stress load. I have very long hours. My average day is 10 to 11 hours. I rarely get a break, and I work anywhere from 4, sometimes 7 days a week. So I have very long, drawn-out days. I've still been able to handle it fairly well, not as well as I used to, but I can still handle it pretty well. But I have to have something to look forward to. So when I talked to you guys earlier about having whatever your stress relief is, I always plan a trip or plan something, so I have that to look forward to, and that gets me through my rough work weeks. A huge thing I would say is get mentors. Meet people in the field, make connections, talk to them, have them coach you throughout the years. And that is going to be vital to your success. And I think just vital to your growth. I had my dad. I had a lot of other veterinarians I knew because of my dad. Even when I got out of school, I made a lot of connections with different veterinarians and specialists who I still keep in touch with to this day. And I still have surgeons who are my mentors so that I can learn and do these different advanced procedures. Experience, personality, and hard work go a long ways. If you're trying to get into a residency or even trying to get into a university, grades definitely matter. And where you graduated matters. But once you get out of that and you're looking for a job, when I'm hiring a veterinarian, I don't necessarily care where they went to school, and I don't necessarily care what their grades were. For me, hiring somebody, I care more about their personality, how well-rounded they are, and that they're hard work and they're going to show up to work. And we see more and more these generations coming through of graduates who don't have the drive that you would expect from a professional. And that's just showing up to work on time. Look, wearing the clothes that you're supposed to wear, looking the part, acting professional. So just those simple things go a long way, and they'll go a long way getting into school, getting through school, and once you get out of school. So keep that in mind. Once again, your mental health, we talked about earlier, is going to also help you to stay mentally healthy, mentally strong for the endurance of your career.
Thank you all for listening to our third episode on Med Advice. Make sure to comment on what your favorite animal is. My favorite animal is a panda. I'm super excited to learn about what yours are. If you love this episode, please share it with those who have an interest in medicine, and stay tuned for more interesting content all here on Med Advice.